Good morning, everyone. Good afternoon. Welcome to our next session of the QMS course, sponsored by Pathologists Overseas and ASCP. Today, we're very excited to have Dr. Diana Wellams talking about purchasing and inventory. She will not have any polling questions during her presentation, but during her case scenario, there will be 2 polling questions. So please be prepared to interact at that point. If you have questions during the presentation for Dr. Wellams, please put them in the Q&A box located at the bottom left. If you have a technical problem, please put it in the chat panel at the bottom right. As always, this is being recorded and will be available on the loading page within 24 hours for you to review. And that should not have a password. I know some have been having problems with passwords being required, but we are clearing those. So you should be able to access all of the recordings without the passwords. And with that, I'm going to turn it over to Dr. Wellams.
Hi, thanks for having me. My name is Diana Wellams. I'm a medical microbiologist working in Vancouver, Canada. I work at a big private lab here. And today we're going to be talking about purchasing and inventory. Please feel free to ask questions as Dan mentioned, and we'll get to as many as we can, and then we can do a little more of an interactive session for the case that we have. So just some of the objectives for today's presentation would be to list some of the factors when considering for procurement of your supplies, how to implement an inventory control program, how to monitor your inventory, and the importance of documents as they relate to purchasing and inventory. I'm sure you guys have all seen this slide many times in terms of the quality management system, and as you know, a lot of these things relate to each other, and purchasing and inventory falls in here as well. So when you're sort of thinking about purchasing system and your inventory, the two go hand in hand, because you're going to have to choose what materials to buy, and in order to do that, you're going to have to look at the options for vendors. You're going to have to figure out a contract with those vendors that determines how much you're buying, how much it costs, how often it's being delivered. And then once you do get it to come to the lab, you are going to have to make sure that it is of good quality through inspection, and then you're going to have to store it in the appropriate conditions. You're going to have to maintain your supplies of it to make sure that you have enough in stock all the time, you're not running out. You're going to have to document that it is in good condition when you receive it, and then also by doing QC while you're using it. And that you don't keep using it after it expires. And then also you're going to have to try to make sure you keep the right amount in stock, so that you're not running out, but also so that you don't have a big surplus on your shelves taking up space or expiring. And depending on the situation you're in, your lab might be also shipping things out to other smaller labs or sort of satellite labs as well. So that's something else to consider keeping track of. So when you're deciding what to buy and who to buy it from, some things to consider are any kind of government requirements, especially if you have to bring products in from out of country. That's a good thing to know. Price is always an issue, and we'll talk about that a little more. You want to look over the contract to make sure you know what you're getting into in terms of the volume of materials that you're getting. The expectations in terms of who's getting paid when, the expectations in terms of what happens if there's a problem with the product, how long the contract lasts for, that sort of thing, as well as practical things like when the products are going to arrive, how big the batches are, what time they're coming, how they have to be stored, that sort of thing. And then of course, there's a way to pay for it, and that's going to vary a little bit by institution. In terms of choosing who you buy from, i.e. the vendors, these are a few phrases taken out of the most recent ISO document. So you should have a procedure for the selection of services and equipment. And this can really be straightforward. I'll give you a little example on the following slide. You should have a list of selected and approved suppliers. So that does speak to the fact that you may have to buy from multiple different suppliers, and you may end up in a situation where one supplier has a shortage. They do add this little phrase in, however, it may be necessary to collaborate with other departments, referring to the fact that, you know, suppliers sometimes do have limits. They may have a back order, and so you may need to figure out other ways to get those supplies from another department or from another institution or something like that. And we'll talk a little bit about that later. Describe the requirements for the products to be purchased. So that would include technical requirements. You know, so if it's a particular product, the characteristics of that product, and what tests you're using it for, and the quality, the volume, the cost, that kind of thing. So again, it needn't be too complicated, but you should have at least a clear outline of the basic requirements. And then you also, this is important, and I think something that we are more likely to forget, is monitor the performance of the suppliers. So this is a good thing to keep track of, because you can use it as sort of leverage to either help the suppliers improve their products to you and their which benefits you, and also as leverage to decide to switch suppliers, or, you know, proof to help you inform your decisions going forward. So this would include issues with QC failures, or when you get into back order. So when there's no supplies available and you have to scramble and look elsewhere, that's obviously not an ideal situation. So it's great to have a way to document this, so that when you when the contract runs out, or when you're deciding to order in the future, you can look back on these and say, hey, was this a good supplier for us, or should we maybe consider somebody else? So in terms of having the procedure to choose a supplier, this is just a super simple procedure that you could have as an SOP. So, you know, you determine that there's a need for a particular supply. Maybe you establish a selection committee, so that might include, you know, a lab manager, maybe somebody on the bench who has a practical understanding of the test involved. Again, depending a lot on the structure of your lab, maybe you do have somebody who is in charge of purchasing supplies and has good relationships with different vendors. Or if you get your supplies from a government agency, maybe they have contacts within that agency. So they they would be on the committee, or maybe you have a really small lab, so, you know, there's only one person doing this. And then you would brainstorm the requirements and obtain information. So maybe you would do a quick search online to see what products are out there. Maybe you would speak to some other colleagues at other labs, or your own lab, who have experience with different products. Or maybe, you know, honestly, there's only one or two choices depending on what you're looking for. And then you would contact the vendors to see how much things would cost, and the availability. And then if it's a suitable vendor, great, you can contact the vendor and go ahead and sign a contract. So there should be some sort of procedure in place. It doesn't have to be too complicated. This would be an example of a very simple procedure. So some practical issues in terms of choosing suppliers or vendors. Often you'll get deals or discounts if you're buying in large volumes, or if you have a standing order. That is, if you have sort of an order that's renewed on a regular basis, because then the supplier knows that you have sort of a long-standing interest, or if you are using other supplies from the same company. So, for example, our antibiotic susceptibility system is an automated system called Vitec. The company that runs Vitec is Biomeria, and they have a bunch of other products as well, and culture media, that sort of thing. So, you know, by using one of their lines of products, we sometimes will get a discount with the others. And so that's something worth considering. If you can talk to other labs about their experience with a particular product, it's helpful, because you'll get a sense of the customer service and issues with product recalls or contracts, that kind of thing. And some examples of things that I can think of for this were a lab that I trained in. We purchased a big piece of equipment, and it turns out that the customer service was in another country in a different time zone. So that was a big pain because, you know, when we needed the customer service, sometimes they were closed because they were operating in another time zone. So something, details like that to consider, that sometimes it's helpful to talk to your colleagues about. Your priority versus other labs. So working in Canada, we're just across the border from the US, and our population is much smaller than American population. So when it really comes down to it, sometimes it's hard for us to compete with big American labs for supplies. So if there's going to be a limited supply of things, they'll sometimes go to larger labs. You don't have much control of that, but it's nice to know ahead of time if it's going to be an issue. Like flexibility in terms of, you know, if you need an urgent box of something because you forgot to order it, how fast can they get it to you? If you have a contract with them, are there penalties for ending the contract early, i.e. financial penalties? Would you have to pay out the contract even if you don't use the supplies? And this is more relevant to equipment, but is there a service agreement? So if there's someone who's going to come fix the equipment regularly, is that included, or do you have to pay extra? And it's worth thinking about that. In some places, you may be getting supplies from a central supplier rather than choosing the vendors yourself. And I think there's probably advantages and disadvantages to this. I don't have a lot of personal experience, but my thoughts are that you may have less flexibility and that it's harder for you to sort of choose a different supplier. But if you have a larger body ordering in bulk, that may be more reliable in terms of supplies. And potentially, if everyone in your region, for example, is getting supplies from a central area, if one person runs out, it may be easier to sort of beg or borrow from someone else if everyone's using the same products. But I do think in this situation, it's still useful to maintain records of any kind of problems with the supplies you might have, even if you're not using it to sort of choose or move away from a given vendor. It at least serves as a record of problems and could help improve the processes and provide feedback for any kind of storage or transport issues, that kind of thing. So that was what we're going to discuss in terms of purchasing. And of course, it is sort of related to inventory management. It's the reason that you have inventory is because you have chosen who to purchase it from, and now it comes to you. So the next component is managing this inventory that you have now purchased. And the reasons for this are many. Obviously, you want to make sure that you have the supplies that you need and that they're available when you need them. Quality is, of course, a big issue because you want to make sure that they're transported correctly and stored correctly. They're not expiring, and that you're able to do your testing in the way you want. And also financial concerns. So you want to make sure you're not wasting things that are costly, and that you're staying within your budget, both financially, but also sometimes space is almost something you have to budget as well, because you may have limited storage space. So trying to make sure you have enough space to put things and for people to work. So some of the challenges involved in managing all of your inventory include finding a balance between making sure you always have things available and making sure you don't have so much of them that they're expiring before you can get to use them. Physical storage space, as I mentioned, again, I think this is an issue in every lab, but it seems that even the lab that I work in was renovated about 3 years ago and into a huge new space, but somehow almost from day one, there's already issues with having enough space to put different things. So space is always a challenge. And another challenge, depending on what kind of testing you're doing, is that there may be differences from week to week or season to season in terms of how much supplies are used. So some tests, for example, you might use more of during the winter if there's a flu season or something like that, or maybe the doctors in your hospital have run ORs on only certain days of the week, or there's a certain type of clinic on one day of the week, so you're going to run through more supplies on one day than another day. And then always the issue of suppliers not being able to provide supplies in the way expected, and there's a back order, and so you have to figure out what you're going to do about that so that you can keep using your supplies. And so the way that you try to keep track of all of these things is through an inventory control system, whereby you look at your inventory to analyze you analyze the needs of your lab and your hospital if you're working in that context, or clinic. Then you're going to try to look at what your stock is and what the minimum needs are to keep you functioning at an efficient level. You're going to also have to develop the paperwork that goes along with keeping track of your supplies. So logs to document receipt of new products, quality control, in-use dates, expiry dates, that sort of thing. You're going to have to receive the products when they arrive and decide how you're going to store those in a way that makes sure that you know what is to be used first. You want to store it in a way that allows the product to maintain its integrity, and you want to store it in a way that makes it easy for people to come get the product when they need it, and also so that you don't have too much or too little. And then you're going to try to maintain this system so that you always know how much you have, when you need to order more, and you're going to need people to be responsible for that. So there's different ways to do an analysis of what kind of volume of a particular product you need. I will say that, just a second here. I will say that a lot of these needs analysis are sort of done as though you're starting a lab from scratch, and most people don't start a lab from scratch. They're working in an existing lab, but one way to do it would be to list all the tests in your lab and identify the supplies you need for each test, and then gathering some information to estimate how much of each of those supplies that you're using. So this doesn't have to be by all tests in the lab. You could, if you're introducing a new test, you could do it this way, try to think through the process, and that's kind of what our case was about. Or even if you're in a lab and you notice, oh gosh, we're always running short of supply X, then maybe it's a time to look at that test and say, okay, this is the test, these are all the supplies we need for it, and how are we going to determine how much we're using it in a way that we can then adjust our ordering and our inventory so that we are not running out anymore. And things that you need to know if you're going to determine how much inventory you need and how to order these are things like how much you're using a month, so quantification, and we'll talk a little bit more about that. The priority level, i.e. is this something that is you need immediately and all the time, like a very important thing, or is it something that's, if you had to wait a couple of days, it wouldn't be the end of the world. The order lead time and delivery time. So that means that if you order something, how far ahead of time do you have to order it so it's going to arrive? And that's going to depend on the delivery time. So will it take, only a few hours to get there, or will it take weeks? Your storage space and conditions, does it have to be refrigerated? Does it take up, is it a really bulky item that takes up a lot of space? And then the unit of count. So, does it come in boxes of 10 or boxes of 200? And how long would it take you to go through those? So to determine, back in terms of the usage, that's basically the quantification. There's a couple different ways of doing this. Essentially, you're looking to calculate how much of a particular supply you're using in a given period of time. So you might think, okay, how many pipette tips am I using in a week, for example? Or it could be how many Petri dishes am I using in a month or in a day? When to do this? Sometimes it's helpful to schedule this as a part of an annual process because things do change, obviously, and so it's nice to have a particular time where you're going to revisit this every year. Also, when you're implementing a new test, you kind of have to do this because you have to basically make a best guess as to how much of the test you're going to be using. And then you're going to probably have to revisit that once you get going, just to make sure that your estimates were in line with the reality. Or potentially in preparation for a potential or newly identified epidemic, which is very timely because I think there's a lot of demand for COVID testing right now in different ways, but it's hard to know exactly how much things are going to change on a week-to-week or month-to-month basis. And there's sort of two broad concepts in how to quantify your supplies. One is consumption based, and that's what it sounds like. So based on how much you're already using and how you what your existing use is. And the other one is morbidity based, so more of a theoretical basis for the prevalence of a certain disease in your area. So as I mentioned, consumption-based is based on what you're actually using. So what you're actually using is not just what you're using on the testing, it's what you're using on the testing plus what you're wasting. And what you're wasting could be expired or spoiled due to incorrect transport or storage, for example. But you also want to know, that's sort of a measure of you having too much supplies, but you also want to know if you're in a situation where you're having too little supply because you're out of stock for more than a couple of weeks for any time given a year. So that's I think this is probably the most practical way to estimate consumption because it's really based on your usage. This other method, the morbidity-based method. Oh, one other point about this: don't forget to include your QC requirements in the consumption-based method. That's one thing I think I forgot to put on the slide there, but it is another way that you are using reagents and products. And then for the morbidity-based, this is sort of based on prevalence data or disease incidence with population size, treatment guidelines, that sort of thing. So you may be looking at some sort of test for influenza, for example, and you're coming into flu season. And so you, if you haven't been using this test before, for example, you might use the incidence of the disease in past years or hospital admissions for acute respiratory illnesses as a way to sort of guide your estimates of how many tests you're going to need in the future. Especially if there's a new treatment guideline out by your hospital that says, every inpatient should have a flu test, then you're going to know that you're going to have an increase in the demand for those tests, and that can help you plan as well. Moving on to the next component of documentation. This is a really important component. And ISO also has some suggestions for what you need to record, or not suggestions, requirements for what you need to record in terms of your inventory. So when you are receiving products and also storing them, you need to have a record of the name of whatever product or reagent you have, the manufacturer, and ideally the contact information for the supplier. And this will be practically useful because that way it's easier for you to reorder when you need to. You need to document the date that you received it, and you need to document the date that you put the product in use, i.e. you started using it in the lab, and also the date you performed quality control on it. Ideally, you want access to the manufacturer's instructions, and sometimes it's helpful to have just a binder somewhere of all the manufacturer's instructions for your products. They usually come in the box, and you can just, the first time you get it, pull it out of the box and throw it in the binder. And that way you have it as a reference for whether reordering or also just for using the product. And then material safety data sheets should also be something that you keep in case there's some sort of safety issue where there's a spill, or somebody gets a hold of the product and drinks it by accident. It's good to have those all in the same place so that you know where to go to determine whether first aid is required. And if you have a stockroom, which probably you do, a dedicated stockroom, it's certainly helpful to keep a lot of these records in the stockroom with the products, especially if you're doing the ordering out of the stockroom. Sometimes the QC is helpful to have on the lab bench if you're doing QC on that bench. So this is just an example of a stock logbook for amoxicillin, and it shows the name of the product here. It doesn't look like they've filled out all of the stock log sheet, but presumably there's a date that it's arrived, the quantity, the date it's put into use, and how much is left in stock. So it's also helpful to have an expiry date. And sometimes labs will try to do a minimum stock, so you can try to find a good balance to help you not have too much or too little in stock by saying, okay, I always want to have a minimum stock of 3 boxes of whatever it is, but I don't want to have more than, say, 5 boxes because that's going to take up too much space. So you can try to find this balance of, okay, once we're down to, say, 4 boxes, we're going to order some more. But we're going to try not to have more than 5 boxes in stock. And then something else you can do that is helpful is if you are storing them in a given location, you can make a note of the shelf that you have assigned them to, or if they're being sent out to another lab, for example, the destination where they're going. So yes, just a quick point, if you're a central lab distributing supplies, you should have an outgoing log of shipments as well, just so that you can keep track of that. Now, when you do get orders coming in, it's important to check the products when they arrive, because obviously that's going to influence whether you can use them or whether you need to have a chat with the vendor and order some more. So you're going to verify the contents of what you receive. Usually there'll be a sheet of paper that lists the name of the product and the quantity that you're receiving. You're going to want to check the integrity. So this again is going to depend a little bit on the product. If it's wooden sticks, you're probably just going to pick up a bag and take a quick look to make sure that those sticks aren't all broken. For something like culture media for microbiology, it could be a little more involved. So you're probably going to want to check the thickness of the media and whether there's hemolysis or contamination, that kind of thing. So this is just usually just a visual check. Some products are going to come with a certificate of analysis that sort of proves that they've either been sterilized or that they've done their own internal QC. So that's good to see as well. You want to record when you receive them and when they're going to expire, and update your records accordingly. And something that's practical but helpful is to put the new supplies behind the existing supplies so that you don't accidentally use the ones that are going to expire later. You want to use the ones that expire first so that they don't expire. So these are just a couple examples from the lab that I work in of ways to help you store that are just practical so that you don't forget. So one of the ISO requirements says that you should segregate uninspected and unacceptable items. So one thing that you could do is just have little pieces of paper that say QC pending or something like that, and just clip them on the box or the lot while you're waiting for the QC to pass. And it's just a nice, simple visual reminder to not use that until it's done. And then, of course, when you complete the QC, you take that off. Or this is another way to just sort of stagger the expiry dates on different things. So, just another visual reminder, a little sticky note that says use first, then use second, use third, use fourth. So that's just a very simple way to help you organize your inventory so that you're going to use things before they expire. Using labels on your products, especially things that last a while, so that you can see the date that you open it and also the date that expires. So this has a label already that has the expiry date, but somebody's written the opening date on it. And the other thing that ideally, the point of having these in-use dates and expiry dates is that, one, you don't want to use a product before after it's expired. But secondly, if there's some sort of product recall, or that there's a problem with the product, you want to be able to go back to your records and look through and say, for each of these products, like which patients were affected by this. And so to know that, you want to have the date that it started being used, and to be able to figure out exactly how long it was used for. Just in terms of storage, some practical tips for a storeroom, which are sort of obvious, but you can go into a lot of storerooms and realize maybe they're not so obvious, are having an organized area, ideally clean and uncluttered if possible. You want a lock on your storeroom because things do have a habit of disappearing sometimes. You don't want things sitting out in direct sunlight, especially some products are going to degrade in direct sun. For safety purposes, you do want good shelving. Things are not going to tip over. You want the heavier items on the lower part of the shelves, both for ergonomic reasons, so people aren't straining trying to reach for them, but also because the shelves are not going to tip over if there's the heavier things on the lower part. Ideally, it's well ventilated. In case of a spill, you could prop a door open or something so that the air gets in. And if there's concerns about spills or exposures, you would like some kind of safety stations, so sinks or eye wash stations that are nearby if possible. Another practical tip is to do things like number your shelves and have sort of a little map or a legend with the numbers listed, so that if you're going to find a product that you're not sure where it is, you can consult the legend and say, oh, okay, it's on shelf number 1, I'll go there. And that when the shipment comes in, that product is going to go to shelf number 1. And it just saves time and ensures that things are always in the right place. Something that we've done in our lab that is kind of fun is to actually name the either equipment or fridges or things like that, because people tend to remember the name of things better than they do a number. So we have sometimes we'll have like a little lottery or raffle or something where people will vote for different names for different things. So an incubator could be named Mario and Luigi after old video games, or whatever name it is. Sometimes it's just a fun way of remembering what's where. And then the other challenge, of course, with inventory is figuring out how much you have and when you need to order it and who's going to do that. So you're going to have to do some sort of system that allows you to figure out how much you have and to reorder on a regular basis. And then also to ensure that your records are up to date with what you've ordered, but also for QC, that sort of thing. And there's different ways of doing this. Somebody has to have responsibility for it. So depending on the structure of your lab, maybe there's a lab manager whose job includes ordering, and that's their job. And every week that they're going to go through all of the supplies based on the nice documents you've created already. And they're going to go through and see what needs to be reordered, and then they're going to do that. Or sometimes it's divided by bench. So for example, in a microbiology lab, there might be a bench that does urine cultures. And so maybe that person gets, an hour at the end of every other day to go through the supplies that they're required on their bench and to order those supplies. So you can do this in whatever way makes sense for your lab, as long as there's somebody who has responsibility, because ordering is one of those things that is everyone's problem, but if there's not one person's responsibility, it clearly breaks down. If you are getting your supplies from another lab, like if you're the satellite lab that is getting the supplies, have a schedule for when you're getting those supplies, but also have a way for them to notify you of delays so that you can try to plan ahead of time. And eventually you will have a shortage, whether it's because somebody just forgot to order something, maybe they were sick on the day they were supposed to order, or maybe the supplier just has a back order and you can't get that. So this is when you have to get a little bit creative and think of how you're going to get that. So this is one reason you have a list of suppliers, ideally. So if you run out of a particular type of Petri dish, maybe another company also makes blood agar, and you can call them and see if you can get their supply. Or maybe the lab in the neighboring town has some extra that they're willing to lend you, and next time that they run short, you can do them a favor and lend some to them. Or, I mean, sometimes you might up in a situation where you really just can't get any more of this particular test. So you say you're running the test on an automated platform, but you might have to go back to doing the test manually. So that's something to sort of keep in the back of your mind in case of shortages, is to have backup methods for a particular test. But of course, that requires its own set of supplies. So this can be the tricky situation, is when you run out of supplies and you have to scramble a bit. Another thing that I think is a helpful tool are these things called Kanban, which is from another quality system, but essentially it's a visual reminder of when you need to reorder something. So this is a freezer we have that has antibiotic discs in it, and so once you see this little form that is taped to the product, you know that, okay, this is the last box of this, because there's a reorder point that says 1 box, and it says quantity to order 1 box also. So once you're down to the last box, this triggers you to either add this to the list and somebody is going to order it, or perhaps you're individually responsible and you're going to call this company and say, I need to order 1 more box of this. And by doing that, you're not going to run out, because you still have the lag time of this box to go through before you run out. Or this is another example. So it's a sticker, and here it says reorder point is 3. So you want to reorder when you only have 3 left. Ideally, the maximum you have in stock at any given time is 7, and the order quantity is 4. So if you are down to 3, you're ordering 4, and you'll only ever have 7 in stock. So that's a way of keeping a limited supply, so that you always have supply, but that you also are not using too much space. And also it does indicate the name of the product and the company, that sort of thing. Here we actually have a barcode system, which is great, but not everywhere does. Another issue that comes up is expired reagents. If you're not going through them fast enough, you should be documenting that and then adjust your ordering. Again, that's a good reason to have, an annual revisiting of all of your ordering and inventory, because then you can look back and say, oh, looks like we threw out a lot of our reagent X because they're expired. We should reduce the amount we're ordering or adjust it based on seasonal trends or something. But you can get creative, or a little creative, in terms of what to do with expired reagents. You shouldn't be using them, but you could use them for non-clinical purposes. So maybe if they're still sort of functional, you could use them for teaching or training purposes, so that you don't waste them altogether. Another issue that does come up sometimes is people donating equipment or supplies. And ideally, I mean, this is really not always possible, but if somebody wants to donate something, it's nice to already have some kind of relationship for them. so that you can sort of help guide the conversation towards what is useful for you. I think people who want to donate often want to donate like a big piece of equipment or something, which is great if that's what you need, but sometimes you don't need equipment, you need supplies that are less exciting for someone to donate. But one way to help that is to tell a story. So a lab that I did a placement in once, they really wanted to implement testing for herpes simplex virus for encephalitis testing, because right at that time, all of the testing had to be referred out and people had to wait for results. So they picked an individual patient and told a story about how this patient had to be in hospital waiting for the results. But if the testing had been in-house, then they could have had a negative result and they would have been able to go home sooner, blah, blah, blah. So people like a story about an individual because it makes them connect with that person. So try to think up a creative way to explain what you need. Or you can even get creative. Sometimes people want to see their name on something, right? So could you do something like create a concrete evidence of a donation? So put a plaque up somewhere, or name a bench after them, or something like that, that it sort of caters to what they're looking for. But you can't use supplies or equipment that are faulty just because they've been donated, and that's sometimes very difficult diplomatically, but just from clearly a quality perspective, that's not okay. Having access to computers is great for managing stock. Spreadsheets are wonderful things. It can really help you plan your orders, plan the distribution if you're sort of a hub site distributing to other sites. Just sometimes it's nice to have like a visual reminder of when to order, that sort of thing. And of course, you do need a computer for that, and you do need someone who knows how to use the computer. And if you're in a situation where you have power outages or something like that, just you have to make sure that your computer is not going to, that it is still going to be functional when you need it. So if you don't think your computer is going to be working for you, or you only have one person who can use it, then it might not be the system for you. But if you do have good access, it can make things a lot easier. And this is just an example of a spreadsheet for some products in our lab. So it's an example of the dates the product was put in service, when it was received, which lot number, both box and bottle, when it expires, what lab bench it's going to, and then the person who was involved. And there's sort of a comment section which can be helpful, as well as this particular reagent expired, and so it was taken out. So that's helpful to know if you're later going back and seeing how much you need to reorder. I'm not super sure if I should be answering let me just take a look. Okay, we're just gonna put questions in the Q&A box. Okay, great. In terms of product recalls, as I mentioned earlier, your inventory system should ideally be designed in a way that you can go down to the individual patient level in terms of which supplies were used. So if there's a recall where a given product has been deemed to be unreliable and you should not be trusting the results, your log should be able to say, okay, these are the dates that was used. These are the dates that it was this product was put in use. This is the QC at the time, which can help suggest that it was reliable or not reliable. And you should be able to figure out which patients were affected through your own records. So sometimes it is helpful to have both the in-use dates and the QC in the same form, because that way you can go back to those products or that spreadsheet for if there's a recall or something. Hopefully this doesn't happen too often, but it does make life a lot easier if your records are in order when it does happen. Oops, just a second here. So just a quick summary of what we talked about. Ideally, your lab's going to have a good system in place for purchasing determining which vendors are the right ones for you, deciding how many of a certain product you need and when, how to store that product, how to ensure that it's reordered at the right time and at the right quantity so that you have enough in stock, but not too much on the shelves. And there is a fair bit of planning and monitoring involved in this, looking at your needs, developing forms and procedures, and maintaining. And you should have a system for every reagent and supply that you use in the laboratory, even if it's just wooden sticks or pipette tips, that sort of thing. I will say that even the best managed labs always run into some sort of shortage at some point, and so there's nothing wrong with that. It's just going to happen, but it is helpful to at that time sort of look at your system and say, okay, how can we do some continuous improvement here? Where did things break down in the ordering? Did we forget to keep a log of this? Was the person who's supposed to reorder away? What do we do if they are away? Is our vendor not the right vendor for us and we need to look for another one? So it's always an ongoing system. You're going to try to go through the exercise and do the best you can. And when you see issues arise, you will just have to try to keep improving it as you go and do your best. And the reason for doing this is to increase the efficiency and effectiveness of your lab. And ultimately, the goal is always to make sure that patients are getting the best results possible for them, and to make the lab staff's life easier by having what they need when they need it. Okay, and I'll end that part of the presentation there.
Great. Thank you so much, Diana. That's been fantastic. We have a couple of questions that we can do now, and then you can move into your case scenario. So the first question is, what conditions should one put in a contract to be signed by the supplier or vendor?
Yeah, that's a great question and very practical. So some of the conditions you would want to include are the expected volume of a product you're using. So again, say if it's pipette tips, it's going to be X boxes of tips. You're going to want to specify the specific product, obviously. So if it's 100 microliter pipette tips versus 1,000 microliter. I know this is pretty obvious, but how frequently it's delivered. So do you need X number of boxes every day, every week, every month? The lead time in terms of how far ahead you need to order. So that may or may not be in the contract, but it's something to discuss with them for sure. So if they need a week to fulfill your order, you have to plan accordingly. But also the expectation should be on their part that they are, that things do come within a week and not within 3 weeks. And price is the other issue, of course. So how much is the cost per box, and do you get a discount if you get additional ones? How long the contract is for. So you could purchase things as a one-off, and that's fine. Or you can have a standing order, so you get X number of boxes every month. And if that is the case, you should ask if there's any kind of penalty for canceling that contract. So if you decide to look elsewhere. And then something else that is helpful is like what is your recourse in case of faulty products, for example. So if the QC fails, like what is the procedure to go back to that company and say, okay, we don't think this product is correct. So what are the expectations on both sides in terms of how to manage that? So those are all some things to consider. For equipment, it would also involve service and that sort of thing. Hopefully.
Great.
And also the storage and transport conditions are another component you should also include.
Right. And I think one of the challenges is you can put those in a contract, especially when you're in an LMIC setting, in a central processing approach, whatever. Those things might be put in a contract with, for example, central procurement, but then the individual labs may not have the ability to enforce that contract, right? Which can be a challenge. So I think when we think about inventory management and challenges of supply chain in LMICs or in places where you have to deal with central procurement, that's always a problem, is that you may be the recipient of products that you didn't actually have the ability to negotiate, which can be really, really challenging. The next question is, which feeds right into that. In most of the time, we have a problem of supply chain management where we have stock outs due to different issues like availability of products on the market, delay in delivery, and a part of this problem is stock out. There are issues of reagent expiration due to different issues, like most of the tests are not requested, so they expire before you use them, quantification issues, short shelf life products. So how can we resolve those above issues related to supply chain management? I guess to summarize that, to say is what's the best solution when you know you're having stock outs? What's the best solution to approach to solve stock out problems?
Yeah, and this is a challenge, and it's especially a challenge if you're not in control of your own ordering. But even if you are, you're sort of sometimes at the, dealing with these big companies that you may not be a priority for. So this is where you kind of get creative. So this is where you might go to your supplier list if you are ordering your own supplies, or if you are not ordering your own supplies, this is where you might make friends with another lab and try to see if they can help you out. Unfortunately, if you have a central supply and they're distributing, you might be also short on the same thing that they're short on. So that's a challenge. So that's when you might also consider to have a backup test method available, so a manual method or something. Another option is to keep if possible, to keep a bigger inventory of supplies on hand. If you suspect you're going to run out, but the problem with that is that sometimes those supplies could expire, and that's another form of waste. So I don't have a simple answer to that question, because I think that's the challenge that we all face, especially if we're not doing our own ordering. But that's where you sort of have to get creative and try to speak with your colleagues and do the best that you can. And do you have any?
Yeah, I was going to add that. Well, I was just going to add to that, one of when we think about anatomic pathology, there's sort of three ways to think about anatomic pathology and reagent supplies, et cetera, that you need. The first is volume, which you've talked about quite a bit. You can't really run an anatomic pathology lab most efficiently, most optimally, meaning at your best dollar per value kind of approach, unless you have like 10,000 samples a year. So we know that the vast majority of anatomic pathology labs that we work with in Africa and other LMICs, et cetera, where they're doing 3,500 to maybe 4,000 samples a year, it's costing them more per sample to do that work than it should, because they just don't have the volume that makes that whole system optimal. But they need a certain set of reagents and supplies to be able to do that work. And so it's sort of a natural thing to say, okay, well, we need X number of labs in this country to handle the volume that we have. And those labs need to be supplied with, the reagents and supplies to do basic histology. But then when you move to the next level, for example, in immunohistochemistry, which is where a lot of people have challenges with stockouts or expensive reagents, et cetera, an organization, and when I say organization, I mean, it could be a country, it could be the public health lab system, it could be private labs, et cetera. They need to decide, how much do we need to have for our volume, which you've talked about as well, and should we centralize that? Should we have one laboratory that's performing, for example, a specialized IHC test, and all the other labs are going to have a transport network to get those samples there to do that? And that way you only have to supply one lab, and that one lab has the volume so that you don't run out of reagent, or the reagents don't expire, et cetera, et cetera. So I think that that's sort of, for anatomic pathology, that's the first two things we think about, is the volume has to be there to support the basic lab. And then for specialized testing, can we centralize that so that we have enough stock in the one place where we're doing it, but we don't have such a low volume in other places that we're never, using the reagents that are there. And then the third component is, what type of services are the labs doing? And I think what we find in the US, is that you'll have laboratories that just do biopsies. All they do is biopsies all day long, right? They don't process big samples. They don't process breasts or colons or anything. They just do, prostate biopsies or breast cores. And they have a very specific and specialized set of stocks that they need to do that work that is very different from someone who may get a breast one sample, the next sample is a colon, the next sample is a rib cage, right? So or chest wall or something. So when you have that great diversity of samples with a low volume, that also puts a challenge in stocking, because you don't know what you're going to get. You don't know necessarily what the volume is going to look like, and so the tools that you need may not be there when you need them. So I think anatomic pathology takes a lot of thinking and planning, for the country, for the region of how you're going to do it, for collaboration between labs, as you just mentioned, Diana. When you stock out, you can work with other labs, but I think the planning for that is one of the ways to solve that stockout problem. So okay, these 4 sites have to have these basic histology reagents, right? But 2 of these sites are only doing biopsies, and the other 2 sites are doing everything. And so they need a little bit more supplies at those sites. And then this one site is doing IHC for everyone, and so that's where you need. So when you think about it from that point of view, you can optimize the system, you can optimize the use of reagents, and you can prevent stockouts because you're matching your inventory to what you're doing.
Yeah, that's a great point. I really was coming at this from the perspective of you're the one in the lab, but if you're planning from a higher level perspective, yeah, I think that's great. And centralization and decentralization is one of those themes that comes up over and over again, but not only in terms of inventory management, but also things like personnel and equipment. It can really affect efficiencies by trying to cluster things where they make the most sense, right?
Yeah, absolutely. And I think, I was answering that question from the point of view of, you're in the lab, you have buddies in 4 other labs, and all of you realize you have the same problem. At that point, you have to elevate that problem to your next level of management, which may be at the hospital level or the government level, to say, we see this as a problem. Here's our idea of how to solve this problem. Can you help us implement this so that, our lab is getting these supplies that we need, but the other lab is getting these other supplies that they need to sort of serve all 4 labs, et cetera. But I think that's questionable or difficult to answer. So another question, when the shipment from the supplier, this is a very, very important question, Diana. When the shipment from the supplier was delayed for unnecessary reasons and the shelf life of the reagent is now short, can you refuse the shipment of those reagents?
Oh, that's a difficult question. And again, I mean, if it's probably not written in your contract realistically, because that's a very sort of specific thing. But that is something that you might want to, again, bring back to your supplier if you're negotiating the contract next time around, and to keep track of, because if you're ending up discarding those reagents at the end of it because you're not technically the contract was fulfilled, they provided your product, but it didn't stipulate, okay, well, they have to be valid for another month and they were only valid for 2 weeks, so you can use them. I mean, that's almost like an overstock issue or an understock issue, right? But that is a tricky thing to negotiate. So I think it's one of those things that you can revisit if you're coming back to your supplier again and say, hey, this is an ongoing problem, and this is something we need to solve.
Yeah, I could probably talk for several hours about expiration dates and the value or lack of value for expiration dates. But I think one of the challenges that many people in the audience probably have encountered, for example, are in automated systems that use barcodes to read reagent kits, for example, in immunohistochemistry on the Ventana system. The system itself will those barcodes will have an expiration date, and the system just won't use those reagents after that barcode date is passed, even though the reagents may not technically be impossible to use anymore. The system won't use them because it'll say, oh, it's past its expiration date. And obviously people do that so that you use lean processing and you lean approaches, and your inventory is what you need and you use it up as you need it and you buy more and more. But that's just not the reality of how our labs are functioning. And they have to work with central procurement, and they have to go through third or fourth party distributors, which jack up the prices, and then it takes forever to get the money. And so when they finally get the reagents, it could be 12 months into an 18-month, and they only have it for 6 months, and then they need it for 12 months because that's the volume they anticipated, but now they only have it for 6 months. And so and if they reorder again, they're not going to get it till 6 months later. So now they have a 6-month stock out. So it's a really difficult problem, and it is all about market forces and revenue streams for these companies, and the companies prioritizing supplying these laboratories, which unfortunately is not happening because of volume. And I'll just give you this example because I think it's very illustrative for the people on the call, on the conference. If you have a distributor, let's say a distributor in Nairobi, Kenya, and that distributor is providing test reagents across the board, like chemistry, hematology, microbiology, anatomic pathology, like whatever test reagents you need, they can get them for you, and they provide it to 4 countries, right? So if chemistry is for them 9 million tests a year that they're providing to those 4 countries, and immunohistochemistry is 20 tests a year, right? They're not going to see that. They're going to work with you on the chemistry test. They're going to give you a discount. They're going to ship every month. They're going to do whatever they need to do, because even if they only make $1 on those reagents, that's $9 million that they've made, right? It's very simple. Whereas if you have 10 labs buying immunohistochemistry once a year, and they're only buying 40 reagents, you can do the math and say it doesn't matter what they charge for that, they're not going to make a lot of money on it. So what do? They either put barrier pricing where they make it so expensive you just don't waste your time trying to buy it, so they don't have to deal with it. So they can put it in their test catalog and it can look like they're doing a service, but they don't ever actually fulfill those orders. Or if you do order it, then they upcharge you on shipping, they upcharge you on importation, et cetera, to try to make their money back, because they just don't have a high margin on those low volume tests. So that's a problem of volume, as you've said, Diana. And I think the way to do that is to have laboratories either countrywide or regionally work together to create a utilization plan for these rare reagents, and then get a contractor or vendor that's willing to supply them, in a way that people can get them, they're affordable, they can still use them, but it is not a burden on the distributor, right? And that's really why there's no easy way forward. It's just a burden on the distributor. So they just like, well, I'm not going to waste my time on it. I don't care if no one gets those reagents. I want to sell what I can sell, right? And so that is a major challenge, and we've seen it both anecdotally and we've seen it systematically happen, and it's a major challenge, but it can be solved, right? And regionalization and banding together labs to sort of purchase in bulk, or to make deals with vendors in bulk, is the way to approach it. That's what we've done with pharmaceuticals, for example.
Yeah, and it does help, again, if, like you said, if you're already purchasing, the vast majority of your products for chemistry, and then there's another, the tiny immunohistochemistry sort of pocket, you have that chemistry leverage to say, well, hey, we have this contract with you for all of these other things. Like, we need you to help sort out this other problem. And if you're only ordering immunohistochemistry, then you have no leverage. But if you have a huge group of people ordering
absolutely
chemistry,
right. That's absolutely right. And one of the really unique solutions, I think it's important for the group to hear this one too. One of the unique solutions that we've run into, for example, in Ethiopia, is that their central procurement system, which is government-based, it's for the whole, for all labs in the country, they have a cross-subsidization model, right? So if you say, oh, we're the pathology lab and we need to order this really expensive test, but only, 400 people a year are going to actually need it. So we only need 400 of those tests a year, but the test costs, $500 per person. Well, if they're already buying and selling 9 million chemistry tests a year for the country, which Ethiopia, that would be very, very well under the number, that actually probably many, many more than that. But let's just use 9 million. They only need to add a penny, to whatever they're doing for that chemistry test in either direction, either by cutting the cost by a penny or adding a penny to what they're reselling it for to the team. And now they have enough revenue to purchase all 400 of those tests and provide them with no change to the system and cost overall. So that whole concept of cross subsidization, where you have a whole menu of tests that have a range of costs, and you can adjust the cost of those to accommodate very expensive tests is extremely valuable. But you can't do that if you're just an anatomic pathology lab by yourself trying to buy immunohistochemistry, because as you said, you have no leverage, you have no ability to cross-subsidize. So it's really important to work within a system that is willing to do that cross-subsidization approach with you. I think that's all the questions we had from the presentation, Diana. So why don't you go ahead and move into your case?
Sure. So just bear with me for 1 second. I'm just going to switch present. The top here. Okay. So the scenario was just, so your lab is asked to start planning to perform COVID antigen testing, and I just chose that because of the timeliness of COVID. It could be any test that you want, whether it's immunohistochemistry or microbiology or whatever. But this is a test that you are not currently performing and is going to require a new set of reagents and products. So essentially, this was just designed to help you think through what you need to consider in planning for this. So I said make a list of things to do. What I find is often helpful is to just sort of think through the process from both a practical perspective and almost like a timeline perspective. So, what are the actual components of this test that I'm going to need to order, and then think it through from the sort of ordering to the arrival to the storage to the use on the bench. That's my mental process, but I think you could take a lot of different approaches for that. So I just wanted to get people to sort of think through how you would plan to do that. And then the other thing that's sometimes helpful is, when you're thinking of what you need to do, thinking of what problems you might encounter. And again, we've just discussed a few problems that are quite difficult to address, certainly on an individual lab level, but on a higher level. But what are things that you could foresee as problems, and is there any way to plan ahead for those? So this is a pretty high level question, but just to try to get you to think through some of the steps in implementing a new test from an ordering and inventory perspective, and then what challenges you might see ahead of time. So I think Dan had created a couple of case scenarios. So here are some of the factors you need to consider planning. What are some of the things you guys thought of as things to plan for?
For this one, you can vote for as many as you like.
Yes, sorry. Thanks for that, Dan.
Hopefully everyone can see that. You may need to scroll a bit to see all the options, but we'll just give you guys about a minute to click on those. There we go. It takes a second, Diana, because they're spread all over. They're spread all over Africa, so it takes them some time to the data to come in, but it's usually pretty efficient. And we usually wait till about either 50% have answered or at about a minute and a half. So
great.
Go from there. All right. Can you see those results?
Yeah, absolutely. And honestly, all of those are things that you're probably going to want to think about at some point. So, obviously you're going to try to estimate your expected test volumes. Again, you could use the two different methods to estimate. You're going to have to figure out who's supplying the tests, where are you going to put them in, what are the storage conditions, documents and records. I think that's one of those things that when you start doing the test, you realize, oh shoot, I really need these documents and records. So, there's a few things we do in the lab that don't require documents and records. Always a good thing to add to the list. How far ahead of time you have to order. And then also something I think sometimes we forget when we're estimating volumes is to factor in any volume of tests that you need for validation or verification of the new test, as well as QC requirements on an ongoing basis. But I'm curious to see if anybody had other things that that they thought of that I didn't include in those lists. I'm sure there are others. Did anybody have any other ideas? Or is that something?
If you have other ideas, you can just pop them in the Q&A as statements of what other ideas you think should be considered. I think it's important to note, well, not important to note, but it's interesting to note that the top 3 from this group are expected test volume, storage conditions, and shelf life, which we just highlighted are major reasons for stockouts and challenges. The other things are obviously, as you said, are all important, but I think, and if you note, lead time for ordering is almost third, but potential suppliers is second. And I think that's, those are also types of kind of issues. Some comments. So funding sources, this is what we're getting coming in. Funding sources, cost, type of test. Let's see what else. Equipment acquisition, like do you need new equipment to run the test?
Yeah, those are really great. I mean, cost is obviously a huge issue, and but yeah, the equipment is a great thing. Like, is this test going to run on an existing platform, or are your staff trained to do this test? I mean, that sort of goes beyond the inventory and stuff, but those are really good points.
Yeah. Okay. Go ahead.
Sorry, I'm not sure if there's any other.
Oh, and lab space. Lab space, how much space you have. Yeah.
That's great, both in terms of doing the tests and also in terms of storage. If it's a bulky product, do you have shelf space for it? Yeah.
Well, and I think, not to derail the conversation, but I think, there'll probably be a really wonderful Harvard Business School case study of what happened during COVID with laboratories bringing, 6, 7, 8, 9, 10, 11 different platforms online in their facilities to be able to handle test volume, and why that was, needed, but why it was highly inappropriate based on what we know about labs and how labs should function. And so I think that gets really to that lab space issue, is like, if you move in 11 systems, what are you now not doing? Because you can't do everything. Or how are you paying for that, system.
And of course, the horrible inefficiency of having to do the same thing 11 different ways.
Exactly. Or integrate it with your IT system. 2 more comments. We have time taken to deliver the reagents, so that feeds into lead time as well, and then biosafety and biosecurity issues, right? So certain tests, you can't do everything everywhere, right? For microbiology specific tests. So those are great suggestions.
Yeah, and that also ties in, are you going to need to buy special masks or a fume hood or something do you have access to those things to be able to do the test? Right. That's a really good point, especially related to COVID. And then, I mean, I guess we've already touched on a lot of these things, but what problems might you encounter in planning and implementation? And are there any ways you can think of to plan ahead? So I think Dan has a polling question for some of the problems. Yeah. Unfortunately, doesn't have all the solutions.
There we go. So give everybody about a minute to answer or so. Right, that was much faster. Let them go to a minute. Okay, there you go.
Right, so yeah, supply shortages, sounds like it's a big concern, and I think it is everywhere. And yeah, interesting. So I'm curious for the government regulations. I mean, I think there's a number of possibilities, but things like getting things imported across borders, or also, for example, where we are, you have to have certain tests on your lab license, and you have to tell the government which tests you're putting on your license and make sure that you're safe to do those things. But I'd be curious to also hear what kind of government regulations that people are facing. For their testing.
If you guys want to put in the Q&A, just put some examples of types of government regulation challenges that you've had with either COVID testing or any kind of testing. I'll share one anecdote. One of my colleagues in Tanzania reported this wasn't early on. I would say it was probably June, July-ish, maybe into August of 2020, that COVID testing was available in Tanzania, but only in certain labs, and no other labs could get the test. And that was because it was being regulated by the government. And that wasn't an uncommon story, but that was early on. I think by October, pretty much most countries, I'd like to hear from people, had opened it up so that labs could get testing if the kits were available to perform them. They could do the tests. But early on, it was definitely a little bit restricted, and that was a emergency kind of thing. It wasn't like because of a written law. It was just because of that specific test. I think importation, as you mentioned, is very challenging, Diana, for tests that contain certain types of chemicals or certain types of reagents, or even raw reagents to run things. So for example, Gene Expert, which lots of people use, for some of the tests requires 100% reagent grade ethanol, which is very expensive to get, but also challenging to import, and can't really be made locally in every country. So that can be a major challenge. Formalin and xylene, which are mainly for anatomic pathology, technically are challenging to import for many different reasons, but not because necessarily of toxicity, but because of the way you have to ship them and that sort of stuff. So someone else has mentioned import licenses, transport regulations like IATA, right, which would feed directly into the toxicity of the chemicals that are used in the laboratory process. And then for the flip side of that, I think, is also interesting, which we're not talking about today, which it's in a different lecture, but the waste from given tests, right? Is that waste toxic or infectious, et cetera? And how do you deal with that? And if that's put to the forefront, that may inhibit you on the front end trying to get a test on board if you're impounded by the ability to get rid of it. And then someone says if a particular test will actually be accepted or considered relevant, right? So a lot of the countries we work with in global health have ministers of health and ministers of finance that work from, sorry, one second, have ministers of health and ministers of finance that work off of WHO policy, right? So if the WHO has something on the essential medicines list or the essential diagnostics list, then they will, then they'll be okay to, that test might come through. But if there's a test which is clearly valuable but hasn't made it onto some superseding policy document, they may not be willing to pay for it, allow you to use it, and it may be restricted by the government, which is painful.
Yep.
Yeah. Okay. All right. I'm going to stop sharing that and let you move on.
Sure. Yeah. And I guess in terms of the problems you might encounter, just trying to think of planning ahead. I mean, it really seems like the supply shortage is the biggest challenge that people face. And I think we've also discussed how this is a challenge for everyone, and also kind of hard to take on as an individual lab without some sort of larger purchasing power. And from an organizational perspective, sort of decentralization or making bulk purchases with big companies can be helpful. But I mean, this is not the best example, and it's not practical for everyone, but in terms of microbiology, there's some labs that decide to make their own media because they have to deal with, issues with storage or transportation. Obviously, that's not a practical solution for everybody, but that's one way that you can get around a particular type of supply shortage. Has anybody had experiences that have been successful themselves that they would want to share with others that were good strategies for getting around supply shortages?
Right. So if you want to share in the Q&A any strategies you have for getting around supply shortages, please go ahead and do that. One other comment that came up on your last question, Diana, was negative customs and beliefs, for example, around COVID tests. So, we know we have a lot of experience with that in the area of HIV and in vaccines, et cetera, where people may believe something about the test, which may extend to a very high level, and therefore the test does not, can't be used because there's someone within the government who doesn't believe it's about, there's some custom around it, et cetera. I think that's less common with diagnostic tests, although I know it has happened. It's more common with things like vaccinations or certain types of drugs or blood supply or types of blood products that are used. But certainly with diagnostic tests, it can happen as well. I know a good example was dengue. So dengue testing, I can't remember the country, but I was at a conference where someone from the Ministry of Health was talking about dengue testing in their country, and how they said, you know, we never had dengue before this test came along, and now that we have the test, we've got cases of dengue, and it's just, you know, that's just bad. And I'm like, okay, that's just because you had dengue and you weren't detecting it. But the belief of this person who was very high in the ministry was that, you know, the dengue somehow had risen because the testing was now available. And, you know, that sounds kind of odd to all of us that are in the laboratory, but you know, a recent administrator of the United States believed the same thing. He thought, you know, if we don't have testing, we won't have cases. So we shouldn't have the test, because if we have the test, then we'll find out we have cases. And that's a political logic. That's not a scientific logic. And so I think making sure that our leadership understands the value of testing, why it's important to have testing, is one way to solve these stockout problems.
I think that's a great point, Dan, and it works the other direction as well. Like, I mean, I work at a company, but the number of times that, but this could happen at a hospital as well. For example, I have a colleague who works in a hospital, and the operating room staff are desperate for rapid COVID tests before their ORs, so that the anesthetists feel safe, but they haven't really thought through the positive predictive value of those tests. So, and what's going to happen if there's a false positive, and the implications for the patients. Or, you know, if you're working in a place where somebody hears about a test on the news and they think, oh, this is the greatest thing ever, our lab needs to implement this test. Or, you know, they know somebody in that company, and that company is trying to pitch that test to them. Or, you know, the government has procured or been donated a bunch of supplies of a certain test, and they tell the hospital, you need to now use this test. So those are all things that are, you know, not necessarily cultural, but they're all based on beliefs and challenges we face as sort of lab scientists trying to ensure that it's the right test for the right population.
Great. I think you can move on, Diana. Go ahead.
Okay. Did anybody have any suggestions for stock shortages, or we're all just in the same boat together?
I think, I think they might be exhausted on stock shortage discussion. So
okay.
I can feel their pain on that one. But yeah, I think what that means is that no one has a really great solution at this point, but we all are in the same boat. So
yes. Okay. Any other additional questions or comments? Or any?
No, we don't have any other questions at this point.
Okay. Well, thanks very much. I feel like I learned a lot from you guys, and the situations that you encountered that are a little different from mine, but it's a good perspective for me as well.
Yeah. Thank you so much, Diana. This has been really great. And I think, you know, this is one of those QMS aspects of the lab that we when we work in Africa, we take this to heart, because it is a daily struggle. It's a daily challenge. And so having your insights has been really helpful. And I think, you know, the group will continue to be on the QMS, and hopefully we'll have questions down the road that relate to this and how we can think about it. But that's one of the things, as I said, that ASCP, as an organization doing global health work, and Pathologists Overseas as an organization doing global health work as well, we encounter it all the time, and we work as best we can to find those solutions. But it is definitely one of the major challenges that remains. And as I mentioned, it's largely due to market forces. And so what we really have to do is work together to create market opportunities for these businesses to supply us in such a way that we can actually get the work done for the patients. So thank you guys all so much for joining us. We have another session on Thursday. You'll be receiving the registration link for that shortly after this call ends. I do not think there is a case for Thursday. It's just a discussion of leadership. So there is no case for Thursday. And we will see you then. So thanks everyone so much, and talk to you soon.
Thanks, Dan. Thanks, everybody.
Diana.